Seeing her with all the lines was probably the scariest thing I've ever experienced. She had tubes, lines, connected to lots of different medications. We never had any doubts. We never wanted to go for a second opinion. If anyone were to come to us and ask us where to take their child, absolutely Children's Hospital. There's no doubt in my mind.
Ariella first came to Children's Hospital as a fetus, so it was her mom that we first met. At 20 weeks of gestation, the first ultrasound that she had here revealed that she did have a complex heart defect. And at that time point, we made a plan along with both the birthing hospital as well as the cardiothoracic surgeons, so that once Ariella is born in the birthing hospital, we would plan to perform an ultrasound of her heart soon after birth. Ariella was going to have 2 large holes in her heart, one between the upper chambers and one between the 2 lower chambers. So this means that she would need a heart surgery after birth.
So right when she was born, all of our team at the birthing hospital, they knew exactly what the plan was. They brought Panda over and they transferred her over to Children's. And from that moment, we knew exactly what steps were going to be taken.
When Ariella was born, we did see that as the extra vessel was closing, Ariella was developing a narrowing in the blood vessels supplying blood to the body. This was an urgent situation and she needed to be operated on within days of her birth.
Ariella's condition may be the best example for our program here. We fixed her narrowing in her aortic arch through a surgery done through the left side of the chest, where basically we resected the area of the narrowing and then reconnected back to back her aorta together.
It's very reassuring to know that Dr. Sunil and Dr. Lamati are in constant communication, knowing that there's no surprises, knowing that they know exactly what's going on. Surgery was 5 days after she was born. They took me step by step exactly what was going to happen.
They looked after her and they took care of her case as if it was the most important case that they had.
The surgery went very well. They were able to close all the holes, but the valve tissue was very thin as she was still very little.
When we were trying to put her on tummy time, her feet would go blue. We went in for an echocardiogram, and that's when we confirmed that she did have her pulmonary vein stenosis, which pushed her second surgery when she was 3 months old.
The operation definitely was not straightforward, but there wasn't much of an option. Pulmonary veins needed to be addressed and needed to be addressed now. The echocardiograms after were really good from the point of complete relief of the pulmonary vein stenosis. There were no more holes between the ventricles or between the atrium. She did extremely well. She was feeding well by the time she went home. I was extremely pleased with how the operation went and the outcome of the operation.
She's so happy. She smiles at everyone. She loves life. I don't know how she recovered so fast. If you look at her, it looks like nothing ever happened. She's just so beautiful and she's so brave.